Hello, I'm Kelsey Baller, and today I'm going to be discussing the frequently debated topic of vaccinating your children. Vaccines have been around for many years to help keep society safe and healthy. Most vaccines are given to infants within the first 2 years of life. This age frame is most common because children are more susceptible to the diseases due to their small immune system, and the vaccines begin building that immune system. In these 2 years, there are a total of 14 vaccines administered to prevent diseases such as chickenpox, measles, and pertussis. Many parents' concern for vaccine begin with the number they are given in such a short time frame. Many believe the amount is excessive and overwhelms the immune system, leading to an overall weakening. Now, while this seems plausible since children are so small with a new immune system, research by Richard Redding has concluded that a child's immune system is not negatively affected by the amount of vaccinations. In addition to an overwhelmed immune system, autism is thought to be a result of the measles, mumps, and rubella vaccination. Parents began to question this theory after Dr. Andrew Wakefield published his research on autistic children. Wakefield found that children with autism had an inflamed intestine that caused the condition, and the inflammation was a result of the MMR vaccine. This publication created waves throughout the world, leading to a decrease in MMR vaccinated children. This caused many scientists to research whether his findings were valid or not. Through many studies, the theory of MMR leading to autism has been disproven. The conclusion drawn from these experiments is the fact that autism awareness has increased, thus increasing amount of diagnosis. Oftentimes, a diagnosis also fell around the same time of a vaccination. A third side effect thought to be caused by vaccines are seizures. This theory was shut down pretty quickly by the basic human physiology. When a vaccine is introduced to the body, it contains a dead or weakened bacteria. The child's immune system can respond by fighting off the bacteria, resulting in a fever. If the fever gets too high, a seizure can occur. So the vaccine can lead to a seizure, but this is extremely rare, and not because the vaccine is harmful, but because of the child's immune system. Vaccinations are beneficial for everyone, not just the recipient. Since vaccine-preventable diseases are still prevalent in other parts of the world, travelers can carry it to the U.S. An unimmunized child could contract the disease and then spread it to other children or an immunocompromised patient. In 2005, an outbreak of measles occurred in Disneyland. It was thought to be a result of an outbreak that also occurred in the Philippines. The outbreak affected over 100 people aged 6 weeks to 70 years old. The initial source was undetermined, but was most likely from another country. These diseases do not stop at the borders. By vaccinating children, the risk of contracting these illnesses, especially while on vacation or in a large tourist area, is dramatically decreased. With such evidence and facts, some parents still question the benefits and fight for the anti-vaccine argument. The movement took off in 1982 when a documentary special aired featuring children with disabilities thought to be a result of the diphtheria, tetanus, and pertussis shot. Parents began forming an anti-vaccine group that influenced many to start questioning the side effects of vaccines. And more recently, a Hollywood star appeared on multiple talk shows discussing her son's autism and linking it to vaccinations. This event brought the anti-vaccine movement into mainstream and still has effects on parents today. Although people have thought that side effects they are seeing are results of vaccines, it is necessary to mention the regulations set forth by the FDA. The Food and Drug Administration monitors the development, production, and distribution of vaccines, as well as the adverse events recorded during use. If the side effects previously mentioned were a result of vaccine formulation, the FDA would not allow them to be in use in a healthcare setting. Also, if there was such an adverse event, it would be public knowledge released by the FDA. These regulations are at the federal level, but at the state level, a school's entry is contingent on vaccines. Many states require up-to-date vaccinations to help maintain the safety of all their students. Overall, the choice to vaccinate a child is completely up to the parents. This debate is very relevant and not disappearing from the news anytime soon. One thing any parent or even person can do is educate themselves on the evidence and facts of vaccines before making a decision. And most importantly, advancements in modern medicine and research can give parents security that the benefits of vaccination do outweigh the risks. Thanks for listening.